Hey guys, welcome back to part 2 of this 3-part series where we're discussing the normal physiology of swallowing, what can go wrong with swallowing and the symptoms to look out for, and the current available treatments to improve your swallow function. If you landed on this video without watching part 1, I highly encourage you to pause this video and go back to part 1 where I break down the normal swallowing process. That's really going to help you understand what we're talking about today. In this video, which is part 2, I'm going to discuss in detail what can go wrong with the normal swallowing process and inform you guys of the symptoms that you should look out for. I do want to give a quick disclaimer. If you are experiencing difficulty swallowing, please do not watch this video and self-diagnose. I strongly encourage you to seek medical advice from either your physician or a speech-language pathologist. This video is meant to provide you with background knowledge so that you have a better understanding of what might potentially be going on. As you can see on your screen, I'm focusing on impairments related to both the oral and pharyngeal phases of swallowing. These are the phases that are within my scope of practice. I will briefly touch upon the impairments that can potentially occur in the esophageal phase of swallowing. And if you feel that your symptoms relate more towards the esophageal phase, please go ahead and consult with your gastroenterologist. Thank you so much for being here. Now, let's get started. All right, so let's start with the oral phase of swallowing. Now, as I had said before, the oral phase of swallowing is voluntary, meaning that you have control over it. And there are several things that can go wrong here. So, for instance, poor acceptance and anterior loss. This may be due to weakness or reduced coordination of the muscles of the lips, especially the orbicularis oris, which is innervated by the facial nerve. The symptoms that you may see are food or liquid spilling from the lips, difficulty taking food off of a spoon, drooling, poor lip seal, and reduced control of food at the front of the mouth. Next, we have impaired mastication or difficulty chewing. This can occur when there is reduced strength or coordination of the muscles of chewing, including the masseter, temporalis, and pterygoids, which are primarily innervated by the trigeminal cranial nerve. If chewing is inefficient, the food is not properly broken down, and this makes it difficult to safely prepare the bolus for transport. The symptoms you may see are prolonged chewing, fatigue during meals, avoidance of tougher solids, needing extra time to prepare food in the mouth, and sometimes even holding food in the mouth without fully breaking it down. Another issue is oral pocketing and scattering. This is when food collects in the cheeks, falls in the lateral sulci, or is not adequately controlled within the mouth. This may be due to weakness of the buccinator muscle and/or poor lingual control. The buccinator is controlled by the facial cranial nerve, and the tongue is controlled by the hypoglossal cranial nerve. The symptoms that you may see are food collecting in the cheeks, food left behind after swallowing, needing to sweep the mouth with the tongue or finger, and reduced awareness that residue is still in the mouth. We also see what we call poor anterior to posterior propulsion. This means the tongue is not effectively moving the bolus from the front of the mouth to the back of the mouth. This is often related to reduced strength or coordination of the intrinsic and extrinsic muscles of the tongue, including muscles such as the genioglossus and styloglossus, which are controlled by the hypoglossal cranial nerve. The symptoms that you may see are delayed oral transit, repeated tongue movements trying to push the bolus back, difficulty initiating the next phase efficiently, and oral residue left after the swallow. And lastly, we can see something that's known as poor lingual pressure. This means the tongue is not generating enough pressure against the hard palate to effectively propel the bolus backward. The symptoms that you may see are food residue on the tongue or hard palate, needing multiple swallows to clear the mouth, prolonged oral transit time, and difficulty moving thicker textures efficiently. Now let's move on to the pharyngeal phase. This phase is especially important because it's the phase that protects the airway, and it helps to transition the bolus from the mouth into the esophagus. One problem that can occur is poor pharyngeal closure. This happens when the soft palate does not elevate and close off the nasal cavity effectively during the swallow. If that seal is incomplete, food and or liquid can move upward into the nasal cavity. Symptoms that you may see are food or liquid coming out of the nose, a sensation of liquid moving upward, discomfort while swallowing, and sometimes avoidance of certain consistencies because they are harder to control. Another major concern, and it is major, is poor laryngeal closure. Now, during a normal swallow, the vocal folds, which are located in the voice box, they come together or adduct to close off the airway. This helps prevent food or liquid from entering into the lungs. Other structures also contribute to airway protection, but vocal fold closure is one of the key components. Another important impairment that can significantly reduce your overall swallowing safety is reduced anterior to superior movement of the hyolaryngeal complex. This refers to reduced upward and forward movement of the hyoid bone and larynx during swallowing. This movement is very important because it helps protect the airway and also assists in opening the upper esophageal sphincter. When this closure is reduced or delayed, it increases the risk of aspiration, which is when food and or liquid enters the airway instead of going into the stomach. Symptoms that you may see are coughing during or after swallowing, choking, throat clearing, a wet or gurgly vocal quality, recurrent chest congestion, recurrent pneumonia, shortness of breath during meals, fear of swallowing, and sometimes silent aspiration. We may also see poor pharyngeal peristalsis or reduced pharyngeal constriction. This means the muscles of the throat are not contracting with enough strength or coordination to push the bolus down efficiently. The pharyngeal constrictor muscles normally work in sequence to generate pressure and move the bolus through the pharynx. Lastly, we have reduced opening of the upper esophageal sphincter, also hyphenated as UES. Now, as promised, I am going to mention some of the impairments that can occur in the esophageal phase of swallowing. This is not within the scope of practice of a speech and language pathologist, but it is within the scope of practice of a gastroenterologist. But I am sharing this with you so, again, you're aware of what might take place and some symptoms to look out for. So in the esophageal phase, the problem is not really initiating the swallow, but rather it's the transport from the esophagus into the stomach. Some symptoms that you might feel are frequent heartburn, GERD, regurgitation of food, chest pain or pressure, frequent burping, the sensation of food sticking in the lower throat or chest area, coughing or gagging after meals, hoarseness, having a sour taste in the mouth, or just unexplained weight loss. All right, so now that we discussed what can go wrong with swallowing and the symptoms that you should look out for, I want you guys to go ahead and watch part 3, where I discuss the current treatments that are available to help improve your swallow. That video should pop up right about now, over here. Do you see it? All right, go ahead and click that video for part 3. Thank you so much for watching part 2 and also for watching part 1, and I'll see you in part 3.